I think that you're hitting on something that's so fundamental. I think, you know, what we've done here is when I first started, we started collecting data on our clinical trial enrollment, and over the past 2 years, we're getting ready to actually publish this data. We have impressive enrollment rates, at least in the lung cancer program, right? And we wanted to understand why that is. And we actually did a study where we utilized surveys, and we gave surveys to patients to kind of understand why or why not they're enrolling in clinical trials. And it was interesting. I mean, in a sense, it wasn't surprising. The biggest thing that led to someone enrolling was trust in the physician. So I think, that's fundamental, and that's not something that you can necessarily teach. But I think through education, there needs to be better education initiatives, and whether that means providing education about what a clinical trial truly is. I think, I haven't encountered a lot of mistrust because of the way that I think I present a clinical trial as not so much, necessarily, we do have phase 1 studies, but it's not so much a new drug that nobody's ever used, or a mechanism that nobody's ever thought about. It's more that we have studies utilizing medications or similar medications to what's already being used, but just utilizing them in a different way. So that, I think it's a number of things that have led to our success. I think it's our ability to talk frankly and openly and establish that trust with the patient right up front. And then it's also the fact that, we're cognizant about the types of trials we're bringing in and the types of trials we're developing for patients. I think there's a whole feasibility and there's a whole logistics part of things, especially for my patients, that need to always be thought about. How often are they going to have to come for a follow-up, right? What are providing support. Many of my patients have socioeconomic factors that lead to them, for whatever reason, not being able to come, or not, just hardships, right? And being able to provide for those hardships is a huge thing that we can offer patients through clinical trials and through just them coming and being part of our cancer center, not necessarily through a clinical trial. I think the other aspect to clinical trials is traditionally where clinical trials have been done are not usually the academic centers that see a diverse patient population. And so to expect those centers to just all of a sudden be able to recruit a diverse patient population is probably not reasonable. And especially not reasonable if you don't put into practice an educational component for physicians as well as patients into what a clinical trial is. And understanding, what are the barriers to clinical trial and enrollment in different patient populations, right? And so hopefully some of our work that we're doing here will help other institutions kind of develop programs that will improve clinical trial enrollment for, underserved, underrepresented population of patients.